Pneumococcal disease is caused by infection by a bacteria. This bacteria is called Streptococcus pneumoniae. So this bacteria can live inside our nasopharynx, which is at the back of our nose and our throat. And living there, it can also spread to other sites and cause infection. The younger the age group, the higher the risk of getting the pneumococcal disease. And the younger the children, they can get a more severe infection, which we call invasive pneumococcal disease. There are more than 90 types of pneumococcal bacteria known worldwide. Pneumococcal disease can be divided into non-invasive disease as well as invasive disease. The non-invasive disease includes sinusitis as well as acute otitis media. Sinusitis is actually infection to our sinus, whereas otitis media is infection to the middle ear. Invasive disease is a more severe infection, which includes pneumonia, which is the infection of the lung, bacteremia, infection to the bloodstream, as well as meningitis, which is infection to the layer of the brain. There are basically two types of a pneumococcal vaccine. One is called a pneumococcal polysaccharide vaccine, which is mainly for adult age group, whereas the other one is a pneumococcal conjugated vaccine, which is more suitable in pediatric age group. The pneumococcal conjugate vaccine, which is also called PCV, there are two types, which is PCV10 and PCV13. Of course, pneumococcal disease can cause a very severe illness, and it can cause death. It can cause a very long-term sequelae. Example, meningitis, which is infection of the layer of the brain, can lead into a disability in the children later on in their life. So, of course, it is better to prevent than to treat the illness. Besides that, it is actually cheaper to vaccinate compared to treating the child, because if the child get a very severe illness, they might need a prolonged hospital stay, they might need intensive care stay, and this is actually much more expensive than vaccinating the child itself. Besides that, we are seeing more of emerging resistance towards antibiotics. So nowadays it's not easy to treat the pneumococcal infection as it was before because of the resistance towards antibiotics. Hence, it's actually better to vaccinate. Parents are encouraged to vaccinate their children early. This is because the younger they are, the higher the risk towards invasive infection, which means the severe infections. And having adequate doses of vaccination will help to ensure that the child is enough and properly protected. In pediatric clinics, we not only give the immunization, but we also see the children as a whole. Means we are looking into other issues as well, such as their growth, their development, their nutrition, and we can also counsel on any other medical issues that parents have concern with in their children.